the leadership lecture series for you, for those of you who might not have attended before, as well as the two speakers that we have tonight. I'm also going to tell you how you can go about asking questions during this leadership lecture. So the leadership lecture series for the Department of Applied Communication started several years ago. Actually, it was a joint effort from our Alumni Advisory Council and the department faculty. And we have tried over the past few years, I think this is the fourth year that we've had it, to have a list of renowned speakers. And when I say renowned, that means that they have done some interesting work that makes a difference in their community. And we want those speakers typically to be alumni or alumnus of our program. Sometimes, though, it's also faculty that do interesting research that are part of our department. So this year we had Dr. Bailey Oliver, who talked about step families in the fall. And tonight we are honored to have Dr. Malia Hill and Dr. Marceline Hayes. And let me introduce them to you. Marceline is actually representing our department as an alumnus in the past. So I'll start out and introduce her first and then introduce Malia. Marceline, we know her because she is Dr. Carol Thompson's daughter. And at the Department of Applied Communication, that brings a lot of weight because Carol is one of our beloved faculty for many years, still in our department. Marceline is the Department Chair of Communication Studies at Arkansas State University, and she's the author of several published manuscripts in journals such as the Journal of Family Communication, Communication Education, Argumentation and Advocacy, Computers and Human Behavior, and the Southern Communication Journal. And her she's a co-author of this book called From Awareness to Commitment in Public Health Campaigns. The Awareness Myth, and Dr. Malia Hill is the co-author of that with her. And Malia is a professor of strategic communication, also at Arkansas State Communication. She worked as an award winner reporter and photographer at small daily newspapers in Arkansas before she moved into public relations and administration in higher education. Continuing her work, she continues to serve as a consultant and volunteer with media relations for nonprofit organizations. And when I found out that they wrote this book and are Building Bridges with the Community subcommittee that works on getting speakers for this leadership lecture, we thought this would be a really good way to highlight one of our alumni, but also to highlight some important work about public health and awareness. So we're really grateful that you're here tonight and look forward to this leadership lecture. There are several ways that you can actually ask questions. One of the ways is to ask the question in the chat box, and Dr. Bailey Oliver and I and Dr. McIntyre, Kristen McIntyre from the department, are going to be watching for the questions. We'll be fielding those questions at the end of the lecture, but you might have the questions come up during the actual leadership lecture itself. And so feel free to ask questions in that chat box, or you can use, because we're using the webinar version of Zoom, you can use the question answer QA box that should be at the bottom of your screen. And if you use that, you can actually see the questions that other people have asked, and you can vote that you really like that question too, so that it goes to the top of the list. And so we're going to have an amazing time learning tonight. And so we're excited to welcome Malia and Marceline. And I don't know which of you is going to speak first, but I'm going to be unspotlighted here and let you all, I'm going to turn it over to you all. Welcome. Thank you.
So I'm going to get us started with this. I already have the PowerPoint up, so I hope everybody can see it and this works well for us. First thing I wanted to do is just do kind of a little quiz type thing. So can you guess the number of national health observances recognized by the U.S. Department of Health and Human Services? And I don't know how we'll do this without.
People can put it in the chat if they want.
Okay, so I don't know, since I'm doing the PowerPoint, if I can, how easy that is going to be for me to see. But
Malia can call them out if you want.
Anybody take a guess?
A former student is with us. Cord, what's your guess?
Cord, can you put it in the chat?
Gerald says 200.
Amar says 10.
Okay. Okay, so there's actually, let me see if I can,
Cord said 75 plus.
The plus
I'm
part.
trying to move to the next slide. That would help. Let's see here. So there's 225. So that's about 60% of the year is dedicated to some type of health observance. So we should be pretty healthy, right? So can you then match the health condition with the awareness ribbon color? So like heart disease.
Bailey got red.
That is correct. What about addiction?
Lynn says blue.
Actually red. Zika virus.
No takers. Christina's picked up a theme.
Okay. Tuberculosis.
Bailey got it again with an exclamation point.
All right. And
I think
AIDS.
that's it.
Okay, these were all red. So no, not all ribbons are red, obviously, but I'll kind of make a point with that in a minute. There are many different colors. So can you match a health condition with the ribbon color? So mental health, does anybody know the mental health ribbon color? I'll just kind of walk us through these. So that is green. Suicide prevention, and if you do know one of these, feel free to state it. Suicide prevention is yellow. Prostate cancer, you might know prostate cancer, somebody.
Yeah.
In case you don't, it is blue.
Yeah. Nathan had it.
Breast cancer, if you don't know this one, pink.
Got lots of pinks.
And then epilepsy is purple. And so I did, just a few more of these kinds of things, match the awareness month with the health condition. I was looking for months here, but so like cervical cancer is January, World Cancer Day, February 4th. Autism, do we know the autism month? So I would know this, having a child with autism. So that is actually April. Prostate cancer. This one's a little bit tricky, but prostate cancer is in September.
Can
Did somebody get that?
oh, someone said November, and I'm sure the reason Christina said November is because there's the No Shave November.
That's what's confusing about that. So breast cancer is October, so we see pink all through the month of October, the hot pink. But lung cancer is actually November, although it does make sense why somebody would think prostate cancer was in September because of the No Shave November, because that's dedicated to prostate cancer, testicular cancer, and all kinds of men's health issues. So I don't know if they just felt like the month of November was taken because these organizations do vie with one another. And obviously there's many different organizations that take on many different ribbons. And in some ways it's kind of competitive in how they want to position themselves. So I just thought that would be kind of an interesting thing to do. And this kind of gets into the content here, but some true false type stuff. So true or false, pharmaceutical giant AstraZeneca was involved in establishing the National Breast Cancer Awareness Month in '85. Do you think that's true? Or false? I will go ahead and tell you that that's actually true. And I'll say something about that in a little bit too. The red ribbon for AIDS awareness was influenced by AIDS activists after they saw the popularity of yellow ribbons for supporting American soldiers. Is that true or false? That is going to be true. The pink ribbon for breast cancer was originally peach. That's actually true. And the reason that it was changed is because Estee Lauder and Self magazine wanted to take on the cause, but the original person involved in that thought it was getting too commercial. And so she went her own way. And so they had to choose a different color ribbon, or felt like they should choose a different color ribbon. So that's when the peach ribbon became pink. And it was Charlotte Haley. And so I gave away this one, but Charlotte Haley, who handed out peach ribbons to Congress for action on breast cancer research, disapproved of the efforts of Estee Lauder and Self magazine to commercialize the issue. The most popular ribbon is pink for breast cancer. Therefore, statistics for breast cancer should indicate that it's the leading cause of death among health issues. So is breast cancer the leading cause of death among all the cancers? But yet we're all familiar with the pink ribbon and we see it everywhere.
Lots of no's and false.
Yes. So yeah, really it breaks down to lung cancer kills the most people, and then colorectal, then stomach, then liver, and then breast cancer. Even though, I mean, if you're looking at the ribbons as an indication, it would definitely be breast cancer, but it's not that. They just have the best marketing. And so here's just a bunch of the different, ribbons and colors. I don't know if anybody's worn a ribbon, but, I have, you all probably have done this in some form. And I've participated in walks and awareness activities, I should say. So that may seem kind of strange in that the goal for us is to eliminate awareness as an end goal of public health campaigns. Sorry, I'm trying to move my screen here a little bit. And this is because awareness is not innocuous. It is not, it can actually be harmful. So if you're thinking, well, what's the harm in it? We hope to demonstrate how it can lead to misunderstandings and misconceptions, and can even make a certain health behavior worse, like smoking. There's research on smoking campaigns and how sort of the more gruesome it gets, the more people smoke. So go figure, right? But so it can actually harm public health. And awareness campaigns are built on misapplications of Rogers' diffusion of innovations and Grunig and Hunt's description of latent, aware, and active publics. And we'll get to that as well. I'm just trying to give an overview. So we developed the term awareness culture. And awareness culture is basically when, all of the walks, all of the observances, all of the shopping create more awareness, but really nothing else. So it's like this ever increasing bubble that really doesn't amount to any behavioral change in a lot of cases, or in education in a lot of cases. We're going to identify what 5 myths of awareness and then present a theoretical model that we developed based on diffusion of innovation and other theories of persuasion. And our model is unique. It's a processual model that takes social media into account, because even now, most public health campaigns are based on radio, TV, and print. And a lot of people will say, we think that the internet or social media should be taken into account, but then don't do it. Or there's a call to do it, but not a lot of people have done a lot, especially in comparison to how much is done with traditional mass media. So what we did is some of this is ethnographic, some of this is built on case studies that we did of websites, interviews that we've done and things like that. So, and these are the causes that we looked at. So breast cancer, prostate cancer, autism, MLS, or that should be ALS, childhood cancer, and autism. And this is our model. It's just an overview that we're going to talk about in the end, but that's how it looks. So I'm just going to kind of leave that and move on. So, so what's the problem with awareness? Well, there's lots of problems, but one is the lack of visible outcomes for measuring awareness. So how do you measure it? If this were like more of a face-to-face type thing, I would like to get your thoughts right here. But the best people can do is to say things like, well, we've distributed all these handouts and all these materials, and therefore that's a measure of awareness. But really that'd be like delivering a bunch of textbooks to children at school and assuming that they're learning anything. Like you can't really, you can just say how much you've handed out, but you really don't know what has been generated by that. In addition to that, what's the purpose of awareness? There's a very low bar for measuring success. And I just put, what are the benefits of wearing pink socks? And small and limited percentage of products purchased benefit research. Now the pink socks thing, that might be a lot of social support type things when we wear those products, but it's not necessarily generating any more awareness at that point. And some of this, I'll kind of go a little bit more quickly because we're going to get to some of this as we talk about the myths. And so I believe, Malia, you were going to talk about our first two sort of pilot case studies for the book.
Yes, thank you. This kind of got started whenever I walked into Marcy's office after seeing an article, admittedly, I think on Facebook, that a family member shared called Awareness, What a BS Word. And the article was really interesting to me, and it had a lot of comments. And my background, as April mentioned, has been more on the journalism side. I think Cord was a journalism student back whenever I had him when PR, before we reorganized some. And I wanted to know what a qualitative textual analysis would even look like of these comments. So this article was by Erin Santos, who's a mother of a child who died as a result of pediatric cancer. And she goes in this article, she just saw the term awareness one day and just said, what BS? And so then her article challenged the efficacy of awareness campaigns that went viral. And then we looked at those responses. And as we did the textual analysis, the data set was comprised of 6 pages, lots of words and lines, and we found several themes. I give Marcy a lot of credit for this, but action rather than awareness is needed to fight childhood cancer. It seems like a given, but yet awareness, we have 225 awareness observances. What is the action? And then misinformation and slacktivism served as barriers to action. So even if people wanted to have action, what is action? What does it look like? We'll talk about slacktivism more. And then personal involvement motivates action. And I want to give credit to Lynn Webb for helping us. We called her from Florida. We called her in Florida. We were in Arkansas and talked about this, and the personal involvement then shows up in our model. Marcy, next slide, please. And so again, awareness doesn't translate into action. That's what we hear, right? Those are the models, hierarchical effects. Action leads to involvement, leads to awareness, leads to involvement, leads to desire, leads to action. We think that awareness will build into something. And what our research shows is that it doesn't. So slacktivism is whenever someone is a slacker plus activism. Bumper stickers and likes are not enough action. You know, I want to do something, so I click like, or I think I've done something because I've shared a post or got a bumper sticker. They're just not enough to actually make something happen, or that people don't know what difference they're making. Um, Personal involvement does motivate action, and that people may not seem to feel that unless they're directly affected by disease or disorder. They simply don't get involved enough, which then that's a whole nother set of issues. If you are personally involved, what's your capacity um, to make a difference as well? But so that was the first article, awareness, what a BS word. And then we had another analysis on called I Like It on Thee. And this was a Facebook game, not exactly an awareness campaign, but related because it had the goal of raising awareness. And maybe you've seen this pop up on Facebook in October, and it asked women to go on Facebook and post the color of their bra. And that got covered some. The most provocative, a little sensational, in fact, was one in which women were asked to put where they put their purses whenever they got home, in the form of I like it on thee. And then there would just be a status where women would fill in table, counter, something. And then the author, Jennifer Wright, wrote, you don't need Facebook to raise awareness about breast cancer. How does this help? And her article said, breast cancer is not cute nor sexy, but it's serious and deadly. So in the article, I think that's the next slide. Again, it was a qualitative analysis. And you know, the comments that we analyzed, there were some who thought that Wright was taking it too seriously. Others were insulted by it. But our takeaway is that it showed the limitations of awareness, that even again, if people thought that awareness would lead to action, there was nothing in place that said what action actually came about because of these Facebook posts. So that led to myths in our conversations that when we were discussing, okay, so if awareness is not action, what is it? And just in our conversations, we said it's just a myth. Awareness is a myth. And so then further on, well, how do we categorize these myths? And we came up with 5, and that awareness does not equal education. It's not enough. It doesn't equal acceptance. It's not altruistic. And awareness does not equal health, despite all the health observances. So those are the myths that we would like to present quickly this evening. And I think, Marcy, you have the first one with awareness is education, that is a myth.
I do. So awareness does not lead people to becoming more informed or educated on a problem. For example, a good example of that, I think, is for all the success of the Ice Bucket Challenge, people don't know what ALS stands for. I remember watching this after there was another campaign that tried to duplicate the success of the first one. It didn't really work, but Matt Lauer didn't know what ALS was. So if it was supposed to generate awareness, I don't know that it did at that time. So it's amyotrophic lateral sclerosis. And myths and misconceptions abound. Like here are a few of them right here. So it's a myth that people who have the BRCA1 or 2 gene will definitely get breast cancer. There are people that think that. Or people who, without understanding that you can get cancer without having the genes. Or just because you have the genes does not mean that you will get breast cancer. Another myth would be men who have prostate cancer surgery will become incontinent, when the reality is within a year, 95% of those men will have full bladder control. Most people think, there's a lot of myths actually surrounding people with autism, but a lot of people think that they all seem to possess some savant skills. They don't. It's actually rare for the Rain Man sort of stereotype to be true. Another myth is that they just don't like to be touched or they don't like to communicate. A lot of them do, but they don't know how. So those are some of the main points under the awareness is education myth. And it made me think of, when I was first looking this up, Neil Postman, who had a book called Amusing Ourselves to Death. His whole point at the time was that television is making us sillier as a society because we can't really learn anything in a deep way because television gives us a conversation in images. And so for him, having the newspaper would lead to a lot more logical, deeper understanding of things, like if you would read it in the newspaper. Because when you write, you can stop and think about what you're writing. You can revise things. There's an actual format to writing and all of those sorts of things. So it kind of made me connect to this. But for us, I think it would be like the tools of the campaigns are making us silly. It is the products, the walks, the ribbons and things like that, because those become the campaign itself. And we don't necessarily learn very much as a result. That and the idea that awareness campaigns are often built to engender emotion and feeling and not complex thinking, because that would be hard. And like when you really listen to people that have cancer or who've gone through cancer with somebody else, there was a guy who put a quote in our book who was talking about, no one understands. And I hope that they don't. Like, I hope that people remain ignorant and unaware because this is just so difficult. And of course, I think we probably do need to be aware, those of us that want to do something about it. But, that carnival-like atmosphere, in a sense, is not conducive to complex thinking. So those are some of the things under awareness is education. And I've basically already talked about this. So we might get a pseudo understanding of an issue. But really all we know for all the awareness campaigns like breast cancer is that people have breast cancer. We know people have autism. People have prostate cancer. Like, we don't really know much beyond that. And so were you going to do this one, Malia? Or was
I can jump in here on the awareness. The myth is awareness is enough. And the underlying assumption is that so many attempts to influence people's behavior is that they make bad choices because they lack the information to empower them to do otherwise. But that's false, except in a few cases. And what's worse is that awareness raising done in the wrong way can actually backfire, encouraging the negative activities in question. And this is from an article called Awareness is Overrated in the New York Times. And this quotation from Victor Stretcher at University of Michigan School of Public Health is that we've known for over 50 years that providing information alone does not lead to change in behavior. The next slide, it refers back to the Santos article, awareness is bullshit. I'm sorry, is BS. I'm sorry there. Is that in spite of awareness, people often do not take action. And she goes on to say that maybe even because we're also aware that we don't even see the need to take action, and that awareness doesn't inspire action, that cancer is an epidemic in this country. And she was confused as to why people aren't freaking out more than they are. It's just awareness isn't enough. One more on enough, Marcy. And this is Pink Ribbon Blues. And this is, I want to briefly say here that whenever Marcy and I started talking about this, it felt a little bit like tilting at windmills, like we were the only ones who thought this. We would get a lot of pushback, and it didn't take much research to find plenty of books and articles where we were not the only ones who had noticed that awareness was overrated. And this is by Gail Solik, a book called Pink Ribbon Blues. And she was actually quoted in a New York Times article called Our Feel-Good War on Breast Cancer, saying you have to look at the agenda for each program involved. I've seen some questions about fundraising events or walks. If the goal is eradication of breast cancer, how close are we to that? not very close at all. If the agenda is awareness, what is it making us aware of? As Marcy said, that breast cancer exists. And what's happened is with these campaigns is that it's really become visibility rather than awareness leading to action. No, I can't say that awareness doesn't lead to knowledge seeking, Amar. What I can say is that this awareness culture has become a self-fulfilling prophecy, self-perpetuating, where it's wanting to be visible. It's more about being visible than it is about leading to risk reduction. And I think then, Marcy, you were going to talk about awareness as acceptance, that myth.
This is the one that really got me thinking about awareness. It was a conversation with you, Malia, about something else. And then Malia was talking about an article and some experiences with people she knew. And then this is where I realized what was going on and kind of became upset. It's awareness is acceptance. Awareness does not translate into empathy or into compassion. Our chapter covered the story of a family who had a child with autism and other disorders. The family reported feeling judged by others and were often the recipients of either well-intentioned yet misguided advice or admonition by others who thought that the parents either didn't understand how to parent a child with autism or simply poor parents. So even people that knew that my son had autism would try to like tell me that there were places I could go or resources that I could avail myself of. And I was already doing that. I'm pretty smart, you know, we all are. And it's when, you know, when it's your kid, you try to see whatever's out there. So we were really doing all we can, but yet he still had temper tantrums in stores. You know, and he still had, you know, a lot of problems. And that's just the, you know, the problem with autism sometimes. And so it would have been nice, instead of being judged, like in the grocery store and people glaring at me, maybe somebody could have like picked up some of the toys that he would constantly throw down on the floor and like handed them to me instead of like, aren't you going to get your kid to pick those up, sort of thing. And I'd even tell him sometimes he has autism, and it was just like, so, but there are kids that need acceptance, and I didn't really feel like I was getting that. In fact, I felt that, yeah, I was being judged because of that. So this gets into the next one. Were you going to talk about this one, or am I going to?
I can talk about this one. I think Christina's already ahead of me on this, talking about cultural capitalism. The question that came to us whenever we presented this or talked about this, just even in the hallway, would be, well, isn't raising money action? You know, I'm doing something. I'm helping raise money. I'm walking a 5K. I bought my pink socks, you know. And again, social support, yes, I'm not belittling any of that. But I will quote Karuna Jagger from Breast Cancer Action, who says the pinkification of the month of October, from football cleats to coffee cups, isn't helping women. And this is a screenshot from their from their magazine, Think Before You Pink. And this is a photo of a bucket of Kentucky Fried Chicken, KFC, in pink. So yes, cultural capitalism, trying to connect with a product there for a good cause. Marcy, on the next slide, it says you can't shop your way out of the breast cancer epidemic. It's a myth that awareness is altruistic. Fundraising campaigns are often not guided by altruistic motives. They're steeped in shopping, observations, and events rather than finding cures and treatments. There's beyond the awareness or action debate, we get into the issue of how much money is raised, if it is actually raised, how it's used, perhaps even why. Again, cause marketing, cultural capitalism. An example, this is from Think Before You Pink, was Reebok heavily promoted that a portion of its sales would be donated to the Avon Breast Cancer Crusade. What wasn't heavily promoted is that there was a maximum donation. And there was also no way for a customer to know if that cap had been met. And our research showed this was pretty common, that it might be, 10% of proceeds if you buy these pink socks or a pink ball glove from Dick's Sporting Goods, that, so much will go to um, breast cancer research or a foundation organization. But what it won't say, well, it might be an asterisk somewhere else on a website that says up to $50,000. So there's a cap. So what, Think Before You Pink from Breast Cancer Action asked is that there's one more. Marcy, if you could forward for me, please. 4 questions before you make a purchase. Does any money from this purchase go to support breast cancer programs? What organization will get the money? Is there a cap on the amount the company will donate? And does this purchase put you or someone you love at risk for exposure to toxins linked to breast cancer? And that goes back to eating fried chicken. It's called pink washing, where there are things that are actually harmful, but they put a pink label on them and act like they're doing something for a good cause. And then the next myth, the last myth we're going to talk about is awareness is health. And this one was hard. This one was the hardest chapter for me to write. I spent a lot of time just talking to Marcy about this. My mother had gone through breast cancer not long before this. And it's just hard. I had a friend who had gone through breast cancer and had gone to Houston to help bring her back from MD Anderson. And it's just really hard. The social support is important. Her sister's softball team had worn pink ribbons, and this was just really hard. I'll admit that, to realize that not only are awareness campaigns not always helpful, but sometimes they can even be detrimental. Of the websites we analyzed, only the Prostate Cancer Foundation mentioned nutrition. This month in September, the PCF had a hashtag, eat it to beat it. And one could ask, despite the billions of dollars spent on awareness, why is breast cancer so prevalent? And there are many books that go into that, but part of it is about visibility, part of it's about profit, and then part of it is about just quick solutions. And then that leads us to, we're about to the awareness culture. Or do we have one more on this? Oh yes, Samantha King, Pink Ribbons Incorporated. What has happened is that these campaigns, as they mirror each other, right? The breast cancer campaigns have been so successful that other campaigns have tried to mirror that, successful in terms of visibility, and that all the campaigns have developed a similar superficiality in the response that they require from us. They're divorced from any critique of healthcare policy or the politics that actually fund biomedical research. We had a guest author for one of our chapters by a mother whose son died of brain cancer at 9 years old, and she does fundraisers, and her goal is to get the hands. She says she wants to get money in the hands of the people with the microscopes. What is the research, the funding of biomedical research? They can reinforce, these campaigns can reinforce a single issue model of fundraising. They whitewash the illness. We're made of a disease, yet totally removed from the challenge and the devastating realities of its sufferers. And so then that does lead us to the awareness culture that no, it doesn't, sorry. Anyway, the takeaway from this is that our research suggests that awareness campaigns are not effective in leading to a change of behavior, that even the screenings sometimes can have limitations or lead to additional cost, and that I just lost it, Marcy. Just go on to, in the interest of time, just go on to the awareness culture, please.
Okay. So, yeah, I'll just kind of,
Yeah, you just go ahead and take it from here on through our model, just. only
Okay.
on-
Yeah, and I don't know the way we're doing our PowerPoint separately if not everything got in there, but the idea was with screenings, and the thing with screenings, it's possible to over-screen people. And I know it doesn't seem like you could do that, but some people will have small cancers that don't need such aggressive treatment, and sometimes they are aggressively treated through what they found early on. And that's not to say, though, that there aren't people who have the later stages of cancer, they're still dying. So there's kind of a disconnect there. And again, this is all stuff we can talk about a little bit later on, but the awareness myth model, it demonstrates, awareness culture is culture where awareness is considered a panacea for all problems. And what it generates things are, and some of it's good, like social support is fine. But observance days, the month days, donations, events, cause marketing, shopping, and they perpetuate. So the walk you do now is probably paying for the next walk or half of that walk. And anything that you do, most of the time, you're not going to get the full money because of, if you bought t-shirts, it's the manufacturing and shipping and things like that. So people without, just a real good business sense like me, I didn't really understand how little money was getting to where it needed to go. So moving along from awareness culture into theory that we used. What's interesting about diffusion of innovations is when we first came up, we knew that theory, that it was Rogers, but we started reading in some PR textbooks and they were citing to somebody named Lionberger, who we never heard of. And it was like on seed corn and things like that. So we went and we looked up Rogers, the book we could find, and that was the book that had Rogers' revised stages. So Rogers revised his work in 82, I believe. So where it says knowledge here is not the same as what he said in 63, but people are citing his early work. But anyway, so through knowledge, a person becomes acquainted with knowledge of an innovation. I assume we're all aware of diffusion of innovations. It's the one where people can become early adopters, latent adopters, all the way up to the late adopters. And the role of interpersonal communication plays a role in there too. But in terms of knowledge, Roger said that we do have awareness level knowledge, and that occurs when a person realizes that an innovation exists and it can lead to motivation for gaining how-to and principles knowledge. Number two, how-to knowledge consists of the individual learning how to use an innovation properly. More complex innovations require greater how-to knowledge. So the more you want to know and the more you get into something, things become more complex. And that's where people don't want to spend, that much brain power sometimes on these things. And then principle knowledge consists of the principles and theories of how an innovation works. If an individual adopts an innovation without adequate principles knowledge, the likelihood of misuse or discontinuation of an innovation becomes more likely. And then the rest of the model, so that was all under knowledge. And then we have persuasion, which is positive or negative attitudes toward an idea or product. And then that will lead you to seek more information on it. Decision making, so a person either adopts or rejects an innovation. Implementation is when the person has it and they're using it. And then there's confirmation, where they evaluate how the innovation worked for them, and may evaluate it in terms of characteristics of one's social system, such as social norms, personality variables, attitudes toward change, and things like that, and if it really fits for the type of person that they are. You know, you can see this work like if you ever went from like Mac to a PC or PC to Mac, something like that, or the new phones and those kinds of things. So that leads us to the commitment communication model. And again, we've said this before, but our model is dynamic and it's processual. You can enter into it from any point and movement can occur in any direction. The model depicts 4 factors affecting commitment, which is our dependent variable. And we define that as ongoing attempts to solve or alleviate a public health problem. And the 4 factors intersect. And that's what the model looks like. So we have commitment, and then we have, you know, the different channels back there, which makes the whole thing kind of go round and round. And then, well, I guess I'll move on and explain what knowledge seeking, participation, and problem recognition is. So recognition involvement, which I just said problem recognition, but it's the same thing. That's the degree to which individuals view a problem as needing to be addressed based on the level of personal salience and involvement with the problem. That really, we believe, people are not going to get very involved and not be highly committed unless they have a personal connection to the problem. Those same people, let's just assuming we're talking about committed people, then those people would seek out information and education about the problem and would be more likely to participate in activities, even communication activities to alleviate the problem. And then again, communication, you know, is the process by which all the variables interact. And there are some implications for this at a professional level and at a research level. We're academics, so we're going to look at it from a research agenda point of view. But as far as professionals, some of the things that we might tell them would be to take the current mission statements and rewrite them so that awareness is not the ultimate goal of the campaign. Perhaps the goal is risk reduction or education, for example. So somebody asked a question of what's the difference between awareness and education. Awareness is just like a flash in the pan. It's almost just like attention. Like, okay, that's an aspect of it, but then education is learning the how to and the principles type of knowledge. Make sure I'm here on track. So there's the model again. I don't know if many of you have done public health campaigns, but I did find a textbook where Foss condenses the steps from a lot of different campaigns into one sort of, you know, 8-step goal or 8-step model type thing. So for one thing, she says to do a successful public health campaign, conduct an audience analysis using focus groups and surveys to define your goals and objectives, determine clear and realistic goals and objectives, identify communication outlets to reach target audiences such as websites, television, radio, create an engaging campaign message with the social, economic, political, environmental, and cultural contexts, pre-test the campaign and make revisions, conduct the campaign within a certain time frame, and then evaluate the effectiveness of the campaign with qualitative and quantitative approaches such as surveys and focus groups, and then monitor the long-term effects of a campaign. So that's really what we should be doing. To have an actual public health campaign. So for practitioners, we think people need to emphasize the role of personal salience and involvement in defining the target audience. It's not a matter of just demographics, but we really need to know, you know, who is going to be most receptive to messages about cancer. And it's going to be probably people who either have cancer or know somebody really well that has cancer. And the way that you can do that is by listening to those people. And you can do that on social media now. There are many open groups, like on all the major social media platforms, in which we can do this. And even like what in our book, I'll never forget the quote. Somebody was talking about, awareness. Like, how about giving me $15 for a tank of gas? I mean, really just to get a sense of the needs that people actually have. So determine clear and realistic goals. Awareness should not be one of those goals. So since I'm already here, but rewording mission statements, like the example from the CDC, Inside Knowledge, Get the Facts About Gynecological Cancer campaign. The goal is raise awareness of the 5 main types of gynecological cancer: cervical, ovarian, uterine, vaginal, and vulvar. When gynecologic cancers are found early, treatment is more effective. So how could you reword that without the emphasis on awareness? That'd be a question I would have of the audience. I was hoping you could do some of this with us. I don't know if anybody's typing or anything.
Yeah, you've got one answer there. It says to provide knowledge about. Another person said to improve knowledge levels.
Okay, that's getting much better though. So to provide knowledge about, and then you have to get a way to even measure that, In our classes, we would have assignments, right? So we would know if they met the objectives. But yeah, that's headed in the right direction.
Got a couple others. One person said aimed to educate the 5 main types. Another person said share knowledge about preventing with patients who have obvious vulnerabilities.
So if you went into this group and you kind of changed it, and then you started talking about providing knowledge and education, that's totally different. And as educators, we know that. So we could do that, but we can't really raise awareness other than, hey, people have cervical cancer and have ovarian cancer and so on and so forth. Here's a few more tips from smokers. Raises awareness of the negative health effects caused by smoking and encourages smokers to quit and non-smokers to protect themselves and their families from exposure to secondhand smoke. So are there things that we could do with that one? Could we rewrite that one?
Question about is the awareness for healthcare providers or patients, because it's unclear.
Well, usually, like, because it's coming from like tips from former smokers, that's usually just a place created like on the internet that would give these to, coming to that source and reading that. So it wouldn't be to providers. But one thing, I do have to say, just looking at this, most smokers are aware of the negative effects. They just don't care. I mean, they might care, but not enough to quit smoking. So there could be another way to do that. In this, you probably need like actual tips. So this campaign, if you're really looking at goals and objectives, you need to integrate that idea into these campaigns. It's like when we had a campaign, somebody wanted to get people to enroll in a school here in town. And she was talking about awareness even in that. I'm like, no, I think you want students to enroll. So I think you want to have an event and get people there, and you want people signing up, right? Like, how many people do you think is reasonable? Like, what's the objective to meet your goal? So anyway, but that's pretty much in anything. So I'll move on to this one. Let's stop HIV together. Raise HIV and anti-stigma campaign featuring individuals with HIV who share their personal stories along with friends and family, and call on Americans to join in the fight against HIV. So awareness and anti-stigma campaign. Is there a way that you can take the raise awareness out of it and put it with something else? The anti-stigma would seem to be a bit more interesting. So, because a lot of the way that we talk might lead to stigma. So like if you could just teach people different ways to talk about AIDS, and some of that could be from disability literature. You know, people like to be referred to in certain ways and not in others. So you could find out what those things are and kind of operate on that level. The AIDS campaign, raise awareness about HIV and AIDS among all Americans and reduce the risk of HIV infection among the hardest hit populations, gay, bisexual men, African Americans, Latino, and other communities. So, but you know, we know people have AIDS. They know people have AIDS. Some risk groups know that, you know, a lot of people might even know that they are in one of those risk groups. So it's like, what do we really want them to know? And, you know, if we're having difficulty answering this and how do we do this, it's maybe because we need to go back and look at what goals do we really want to have that would help the most. So more for practitioners, in terms of identifying communication outlets, it's important to note there's a shift away from traditional mass media outlets to the internet and social media. In 2005, Hess stated there's a tectonic shift in the ways in which patients consume health and medical information, with more patients looking for information online before talking with their physicians, which is true. That doesn't have, that's not without its problems, but that is true. So we need to understand that process a little bit better. Most people, however, consider their physicians to be the most trusted source of information and actually want their physicians to help them make sense out of the online data. So, you know, that would be a good way that physicians and patients could work together. Reaching people via social media and technology seems logical, effective. It's important to tailor messages to people involved in social media groups and networks, but it's crucial to listen to people and observe their interactions in these groups as well. People who are involved in social media for health reasons are likely and receptive to messages, but campaign planners have to know what the needs of people are and how they function. Not only can healthcare campaign planners reach people via websites and social media, they can understand their target audience better by researching these sites. And an insider's perspective of people who experience health issues must be taken into account. This perspective is likely to emerge from analysis of social media sites and communities, especially the interaction on some sites. Traditional surveys and focus groups can only go so far in understanding insider viewpoints and behaviors. Miller, Day, and Hayes stated narratives are a promising avenue for health intervention. Such narratives can be identified via the internet and social media. In addition to revealing narratives, an examination of social media communities will allow researchers to observe actual information. So again, you know, structuring the campaign around people who are affected by the health problem, because they are going to be the ones that will likely be able to solve it the most. So a couple of these for practitioners. In terms of creating messages, it's important that messages be specific. In order to truly educate or enhance knowledge of the disease or condition, choices have to be made as to what campaign planners want publics to know. For example, in order to truly educate the public about autism, focus on specific points rather than general awareness. Now that we know kids have autism, people have autism, we know that. We know a little bit about it. A lot of it is stereotypical and not that helpful, but you know, what do you want people to know about autism when you're structuring a campaign like this? That it's a spectrum disorder, that it's neurological, that all people with autism are different, because they really are. And so, you know, you just have to be willing to put in this time and effort. It's important to monitor the pulse of public discourse beyond traditional ways of assessing campaign effectiveness. An updated and current understanding of how all communication channels function in a diffusion or adoption process is needed, and the role of social media needs to be taken into account. So, so this leads us to our model. And what we've done is we've taken every variable right now and we have a few items that measure it. So think of an issue or problem you feel that needs to be solved or alleviated. With this issue in mind, answer the following questions on the following scale. And I'll just give you some examples. I think people should pick something that they have or that they feel very strongly about, and we need to know why. Because there's a difference between like me having cancer and somebody else even very close to me having cancer. So we've got a Likert scale. So for commitment, some of the items that we have are, I am dedicated to helping to solve or alleviate the health problem, whatever that would be. I will not rest easy until the health problem is solved or alleviated. I feel an obligation to help solve or alleviate the health problem. It is my responsibility to solve the health problem. I made a vow or promise to help solve or alleviate the health problem. And then of course you put in here like the negatively worded ones, right? Because I want to do a factor analysis on it. And we're thinking about doing an experimental design. And then for knowledge seeking, it has to do with seeking out knowledge on the health problem. I educate myself, I try to learn. I paid close attention to information on the health problem. And so recognition and involvement, you could ask things like, the health problem of blank is very relevant to me. The health problem blank affects my life. I'm going too fast. But the next one would be participation. So I engage in activities to solve or alleviate the health problem. I avoid activities to alleviate or solve the health problem. I spend a lot of time in activities to solve or alleviate the problem, or I don't spend as much time. You kind of get the idea there. And then here is a measure of communication, these different modes. This is going to be more difficult because like if you see in here, like for social media, I use social media to seek information about the health problem. Or I use social media to provide information about, because I just don't know if the same people will be seeking information versus providing information. Or I guess it would be the same if you've got a group on there where people are asking each other's questions all the time. So in that way, maybe they're doing that. But I use social media to participate in activities that help or alleviate the problem. And then mass media. And you know, that the internet, I use the internet to seek information about the health problem. I use the internet to provide information about the health problem. I use the internet to carry out my promise to help solve or alleviate the health problem. So at the end of it, we want to have, you know, models with like little directions showing, you know, maybe do a regression analysis or something like that. But, you know, I don't know if you're familiar with situational theory, and I'm going to forget it all now, but Hunt and Grunig talked about the 4 different types of publics. And one of those is, it all has to do with an audience, if they are involved and do they have knowledge. So like, if you have high knowledge but low involvement, you're aware. High involvement and high knowledge is active, and that's what we want. But low involvement, low knowledge is inactive. And then aroused is high involvement but low knowledge. And we don't think you can get people from like inactive to aware by awareness campaigns. But if you target people who are already in the active range and you listen to them and work with them, then we think a lot could be accomplished. And that's really where I was going to leave it off.
Okay, so are you ready for questions? We have some questions. Do you want to quit sharing your screen so that we can see you better?
Yes, I will figure out how to do that.
There we go. Thank you. All right, Bailey, I know we've had some questions in the chat, and I think, so would you like to start us out by asking some of those?
Yes, so early on, Amar asked, what do you think about fundraising walks and marathons for cancer awareness? Do they help?
Either one of you want to take a,
I think Marcy mentioned this, that I've done them, right? I was a chair for organizations Relay for Life years ago. And I think we've both mentioned that they have a role in social support. If you want to help, if your goal is social support, if you want to be active, if you want to walk, if you want to run a 5K, run a 5K. I would say, I won't speak for Marcy in this completely. I would say if that's what you want to do, social support, yes, they have a place. If you want to help fund cancer research, you don't need a pink t-shirt and a new pair of shoes than to spend your Saturday morning that way. So depending on your goal, I'm not going to say not to do it. We have colleagues who help with organizing an event on campus. Again, I'm not going to downplay the role and the importance it can have in social support. But if you're wanting to help cure cancer, probably skip the hot dog and pink glitter.
good point. There's a question in the question answer. Bailey, do you mind if I ask that one next from Brandon?
Go for it.
All right. And this question has several sub questions with it. So if you guys want to look at the question answer, you can, Marcy and Malia, but I'll read it out loud for the others. I think people might be able to see these as well. Do you think that there is a cycle of guilt for individuals who engage in performative activism or slacktivism? And what do you think the driving force for that guilt could be? Then the second kind of part to the question is, what do you think stops people from fully engaging in true activism? Is it laziness, or is it similar to a mob mentality where if everybody knows about it, then surely someone's doing something to supplement the lack of engagement from the majority?
That last one would be like social loafing. And I mean, if that is true, yeah, if all these people are out there working on this, surely something's being done. So I think there is that social loafing part of it. And I think people, it's a social currency. On public, you're on there liking. On Facebook, just say liking these messages about these campaigns, and it makes you look like a better person. So I think that's as much of a motivation for guilt. And people are just kind of lazy sometimes. Like they think that because they clicked on like, they did something. And it's not the same as somebody who gave some money for research.
There was another question earlier on in the chat, and this is similar to Christina Standerfer's question as well. So the question was, is there any evidence that connects awareness campaigns to knowledge seeking? So is there enough evidence which substantiates that awareness doesn't lead to knowledge seeking?
Do you want to answer this one, Malia?
Well, I mean, I
was trying.
always hesitate to, whenever there's a term like evidence. I mean, we have, that's, I think, something that we would hope that our survey would eventually be able to sort through. But if I'm understanding the question, I mean, I hope we've addressed that. I think I remember seeing that question pretty early, and I hope we've addressed that some. And that what was it? Does awareness lead to or not lead to knowledge seeking?
Is there enough evidence which substantiates that awareness doesn't lead to knowledge seeking?
No, I would not say, I could never say that awareness does not need to wait. This time last year, I don't know that I'd heard of COVID. I guess I had heard about it by now. So if you are completely a blank slate without knowing anything at all, you have to be introduced to something, right, in the very beginning. And then once being introduced, once I'm aware, then I do seek knowledge. I went from first hearing about something to doing nothing but seeking knowledge. So in the very beginning, yes, there would be awareness that leads to knowledge seeking. And I think that's how Rogers revised the diffusion theory. What we're saying is that once there is knowledge about something, that raising awareness stops being effective, and in fact can be counterproductive. I would not say that there's never ever a need for awareness in any situation. And one of those, and Marcy mentioned this, I think I skipped a slide where we actually do say that childhood cancer is a health concern where there isn't awareness. Again, a mother wrote a chapter in a book where an infant, 6 months old, Marcy, not yet, before her first birthday, she had surgery for cancer. And I got chills saying that. No, mothers aren't, whenever a baby has an upset stomach, I mean, they're not thinking of cancer. So there would be a time for awareness. So I would not say that awareness never leads to knowledge seeking. I would say that for many of the causes, we're well past awareness.
Yeah, we're well past it in a lot of ways. There's a lot of sort of backlash now against, the pink October breast cancer stuff because of that and because of some other things that have happened within the organization. But again, it's, the goal was specifically stated as awareness. So all you have to do is hold an event and you've met your goal.
It looks like, oh, I'm sorry. Gerald asked one question in the chat as well, asked, how could you change the nature of the fundraisers? So things like runs, bike rides, etc., so they do more than just social support.
Say that one more time. I got that kind of garbled.
No, absolutely. So how could you change the nature of the fundraisers? So runs, bike rides, etc., so they do more than social support?
Well, don't call them awareness events, I think would help. And then if you're going to ask for donations, tell people what they're for. And some of it gets back into the company's websites. Like, you should be able to go on a website and follow those questions that the Think Pink toolkit that they lay out. Basically, where's the money going? But so a lot of it, retitle the event. Because if you called it like an education event, then you might even have flyers there with like stuff on them that are educational. You might have, your t-shirts might even look differently. You might have activities for people to do where they can actually learn things. But again, like on the company websites, I do think that there's a responsibility there to be more detailed about what they do with the money.
Bailey, could I add quickly? couple of things. I've said that the events, fundraisers, the walks and such are social support. They definitely can be. Someone, a panelist mentioned earlier an article, we think it was the Atlantic, it was in Pink Ribbons Incorporated. There are also some people with cancer who don't find the events all that supportive. Because of the survivor walk, but somebody might have terminal cancer. So even the social support angle can be a little conflicted. A colleague asked me this week or last week about, in preparation for this presentation, if I still believe what was in the book, or if I still thought the same. There's one thing I would change, and that is that I would change the term prevention to risk reduction. And Marcy hit on this as far as education. I think these events could do much more education-wise to emphasize risk reduction that could be done in that moment. Even pledges to do things that are less risky, so that to promote health. So those are 2 points I wanted to make there. Thank you.
Another question we have in Q&A, I think Marceline may have answered it from Christina.
Go ahead and ask it because it relates
Okay.
to the funding.
Yes, absolutely. So do you see a benefit in moving campaigns away from educating people about individual behavior to educating people on how to engage in effective collective action? So what if the NPOs who work in the area of all the cancers, conditions, health problems held workshops on how to advocate policymakers for money, research, or attention, or is that asking too much?
I don't think it's asking too much at all. But do we have an example? Is there an example of where that's going on?
Christy, do you have an example of that? I can let you talk if you do. I want to push the allow to talk. Maybe in case
Look
you.
there, I got to unmute myself. No, I don't have an example, but in the work I've done on diabetes, there's a lot of talk about collective action. What can we do as a community about built environments, that sort of thing. The problem is that people don't have the skills to actually do that. And that most, or at least the work I've done, most of the people who focus on diabetes are either clinicians who are interested in individual change, or organizations who are interested in what Marceline and Michaela, right?
Malia.
Malia were talking about in terms of awareness, without taking it any farther than that. And that on a lot of these issues, it just seems to me that one thing that's missing is the idea of a collective action. How do we advocate for more money, more education, more attention to from whoever doles out the money for those things? That was just my question.
So not really an example other than the fact that you see the need for it.
Yeah, no, because I haven't, particularly in the area of health. I don't know, maybe other people have examples. Well, there's one, and that has to do with money that was given to municipalities during the Obama administration on issues like North Little Rock did Fit to Live, which I think is a horrible title, but it was all about community gardens, getting people to work as in communities on issues of healthy living, getting people in communities to work on issues of how do we get a good grocery store here. That's the only example I have. And that came out of the Obama money on, what was it called? Putting communities to work. I don't remember the name of the initiative. That's the only example I have. Yeah. I'll shut up. Sorry.
Thank you. No, thank you.
It sounds like that it's not people with professional training in campaign, right?
Right. No, because can you still hear me?
Yes.
Okay.
Mhm.
No, because I think that becomes the problem. I think the problem becomes that then they take over the conversation. And particularly in diabetes, because they talk about people being non-compliant, they talk in a language of medicine that regular people don't understand. I think that's why it works so well with the community gardens. It wasn't about diabetes. It wasn't about obesity. It was just about, eating healthy, having a community garden, bringing people together, learning how we can have a better sidewalks if we talk to the city council. And I don't see a lot of organizations working on that. They're working more on, as you said, they're working on awareness, whatever the heck that is, without saying, okay, well, here's some tools to talk to decision makers to move forward beyond your own understanding or awareness. And now I will really shut up. I'm done. Okay.
I appreciate it, Christina, because I know you've been doing some research in this area as well in terms of the collective action in the community. So thank
Yeah.
you.
Yeah.
There are a couple of other questions, Bailey, I think in the Q&A.
Yep. So Nathan Jeffers asked, do you see any philanthropic/research value in calls marketing? These efforts often create positive PR for organizations and simultaneously raise money for nonprofit causes. What alternative would you suggest to this type of partnership?
Malia, what do you think?
I made the mistake of trying to read and listen at the same time. Where was that
So this
question?
it's Nathan Jeffers in the Q&A.
Well, I mean, sometimes that can be a negative thing, like, the Coleman stuff that's been criticized. I mean, like the bucket of chicken, I'm sure that was supposed to be a good thing, but, the bucket of chicken, what you eat there can lead to obesity. And some would say that that's not a good,
That's exactly right. Marcy's saying, I'm there now, April, sorry, but yeah, I can see value in cause marketing.
Yeah, there's
I think
value.
integrated marketing communication. My preference would be that I believe the term is affinity marketing, and that they are related, and certainly to avoid the term is pink washing, which we mentioned briefly, which would be the KFC example, to we sometimes would say wrap yourselves in a flag, wrap yourself in a ribbon, while at the same time engaging in policies or products that are harmful. I don't mind partnerships at all. I do mind products that are detrimental to health.
Well, and Estee Lauder handing out some of the cosmetics that have things like phthalates in them and some other things, but using it under the pink ribbon. So you have to be careful that you're not giving people things that could actually cause cancer. So it's a double-edged sword kind of thing. But again, we need to be asking again, where's all this money going? And is that the best use of money? Because they're spending money on those buckets.
Right.
Yeah.
Right.
That's going to be thrown away. Give people some socks that say KFC or something, pink socks that say if you have to do it,
Bailey, is there another question?
It looks like there's one last question from Savannah again. What are your thoughts on Autism Speaks? There's a large portion of the autistic community that actually find them harmful.
They've got a lot of good resources, and there's stuff that you can learn on their site. I'm not super happy with it because what they tend to do, in my opinion, and from what I've seen, is to try to make your child as normal as possible, which I get why you'd want to do that, but a lot of kids can't do that, and it's harmful to them to get them to do that. And so I'm not real happy with them, but I do go to their site every once in a while and just take, what I can get from it. I haven't thrown them all out.
Avinash does he still have his hand up? Avinash, do you have a question? I'll allow you to talk if you still want to talk. I see a hand up. You'll have to
Yes, I just had I don't have a question actually, but a comment that, the cognitive dissonance theory kind of elaborates on some of the decision making when we choose with full knowledge. We have knowledge about all the bad things that can happen with a certain behavior, but we still go ahead and indulge in a specific behavior, risky behavior, whether it's sexual behavior or smoking or whatever. And so that I just had a comment that, some of the decisions that we take are not based on knowledge. They're based on some other stuff, which we need to take into account when we design our awareness campaigns and behavior change campaigns, I guess.
People don't always do what's good for them.
Very true.
I agree, yes.
Yeah. There's a couple of people that have mentioned that they would love to have your slides. I think I will have access to the emails for the people who have come tonight. So if you, Marcy and Malia, if you wouldn't mind sharing your slides with me and just sending the email, I can send that out by email.
Okay.
If that's okay with you.
Absolutely.
Well, I think we have we've had some wonderful questions, and obviously this sparked a huge amount of interest in the people that have come tonight. And we thank you so much for the important work that you're doing here, because this is, it's important for us to be thinking about how we participate in these kinds of campaigns and why, but also as we think about how do we go about as researchers moving forward and trying to create different ways of motivating people to action. So thank you so much. You see some comments in the chat here about great work, way to explore such a critically important area. It's been a great presentation. Thank you for sharing your work with us. So anyway, I just really appreciate the work that you all have done tonight. So any last comments, Marceline and Malia?
Feel free to get a hold of us if you want to work on something like this for your classes. I'm in the office as chair. I'm in the office pretty much all the time. But we're Department of Communication. We have communication studies and strategic communication. So it gets a little bit confusing, so like I'm between the two right now. I'm comm studies and Dr. Hill is strategic. So I don't know if you have that in your departments, that kind of professional programs versus more academic programs. But anyway, we can give you like a variety of perspectives if you'd like to just talk.
Yeah, and I know people like Amar Conacher, who's here tonight, actually does research in similar kinds of things. So as you're working on and Avinash Tambre and Christy Stanifer, so I'm just looking at some of the people here that might be doing research as you all are working on your survey, and there might be opportunities for you to collaborate. So that would be great if that would be a possibility. That'd be up to you all, obviously. To do that. So, well, thank you so much. This has been a very thought-provoking leadership lecture, and we appreciate you all coming tonight. And I think I can just end this lecture with an applause. If we were here in person, we would be doing applause. But thank you all so much for the work and for participating tonight.
Thank you for having us.
Yeah, and thank you all for coming.
Bye-bye.
All right, clap, clap. Bye-bye.